In Harris County, Texas, which includes Houston, the county executive in Harris County and the top public health official in that huge county today asked Harris County schools to please push their opening dates until October for in-person instruction. And that's important and remarkable sort of touchstone for Harris County, Texas. But Texas overall right now is just in a very serious situation. As bad as the curves are right now, and as bad as the numbers are in these states that we've been watching so closely, in California and in Arizona and in Florida, when you look at their case numbers right now, you look at the very far right side of those curves in California, Arizona, and Florida, and you think that maybe, possibly, if you're hopeful, they might be starting to see a slight slowing, a slight flattening in some of those places that have been just rocketing to the moon. But Texas isn't showing any of that. Texas appears to still be full speed ahead, basically straight up in some parts of Texas. Of the 4,000 roughly deaths that Texas has had from coronavirus, about 20% of those have been just in the past week. And what they call the Coastal Bend part of Texas, local authorities are now saying they believe 1 in 8 people is actively infected in all of those counties combined. The Coastal Bend region of Texas, 1 in 8 people. The Rio Grande Valley is in such dire circumstances now that it's getting national attention. The New York Times today profiling one hospital in Edinburgh, Texas, in Hidalgo County, in a way that really puts it on par with the horror movie reporting we got out of Elmhurst Hospital in Queens, New York, at the early New York peak, which I know you remember. This is from the Times now about a hospital in Edinburgh, Texas, in Hidalgo County. Quote, the 3 facilities this hospital is using to treat patients with COVID-19 have been filled to capacity since the first week of July. At times, a dozen or more ambulances have waited outside for beds to become available. Reclining chairs and hallway beds have been moved into the emergency rooms, where some patients wait more than a day to be transferred into an intensive care unit. With 11,000 active infections in the Rio Grande Valley region, public health officers estimate that hospitalizations could double within 2 weeks. But with every hospital nearby also full, it is not clear where the patients will go. Hospital Safety and Emergency Management Coordinator telling the Times, quote, our curve is a straight up trajectory right now. There is no flattening. There is no relief.